A 56-year-old male presents with fever, distended abdomen, and a bedside ultrasound that shows ascites. A paracentesis is performed and the results indicate that the patient has spontaneous bacterial peritonitis. What daily medication should be stopped upon admission? A. Amlodipine. B. Crestor. C. Lactulose. D. Metoprolol. Answer is D. Metoprolol. Beta blocker use in PTS with cirrhosis with SBP should be discontinued because it has been shown to increase mortality. A 43-year-old female presents with 1 month of abdominal swelling. On examination, she has a diffusely swollen abdomen with a fluid wave. The patient appears to have new onset ascites. In order to help determine the etiology, you obtain the serum ascites albumin gradient. Which value is consistent with cirrhosis? A. 0.25 grams per deciliter. B. 0.5 grams per deciliter. C. 1 grams per deciliter. D. 1.5 grams per deciliter. Answer is D. 1.5 grams per del. A serum ascites albumin gradient value of greater than or equal to 1.1 gdl is found in patients with portal hypertension. There are many causes of portal hypertension, including cirrhosis, liver failure, and heart failure. A 48-year-old male with a history of cirrhosis presents with 3 days of abdominal pain and fever. On examination, he is febrile and has an abdominal examination that is diffusely tender with guarding. The decision is made to do a paracentesis to evaluate for spontaneous bacterial peritonitis, SBP. What is the best treatment for SBP? A. Cefotaxime and discontinue beta blockers. B. Ceftriaxone and dexamethasone. C. Ceftriaxone and discontinue beta blockers. D. Ciprofloxacin and metronidazole. Answer is A. Cefotaxime and discontinue beta blockers. The empirical antibiotic of choice is a third-generation cephalosporin, for example, cefotaxime. If the patient has a history of cirrhosis and is taking a non-selective beta blocker, it should be discontinued because it has been shown to increase mortality in patients with spontaneous bacterial peritonitis. A 41-year-old male with a history of cirrhosis presents with fever, abdominal distension, and confusion. A paracentesis is performed in the evaluation of spontaneous bacterial peritonitis. What is the diagnostic criteria found in the ascitic fluid that confirms spontaneous bacterial peritonitis? A. Neutrophil count 100. B. Neutrophil count 250. C. WBC 100. D. WBC 250. Answer is B. Neutrophil count 250. The presence of more than 250 polymorphonuclear cells per cubic millimeter of ascitic fluid is diagnostic for SBP. A 55-year-old female presents with 1 month of diffuse abdominal swelling and pain. She reports a long history of alcohol use. In the evaluating this patient for jaundice, how high does the bilirubin have to be to become clinically apparent, and what area of the body does jaundice appear first? A. 2 mg per deciliter, nail beds. B. 2 mg per deciliter, sclera. C. 2.5 mg per deciliter, skin. D. 2.5 mg per deciliter, sublingual. Answer is D. 2.5 mg per deciliter, sublingual. Clinical jaundice is usually not evident until the total serum bilirubin concentration rises above 2.5 mg per deciliter. Jaundice is first apparent sublingually, in the conjunctiva and on the hard palate.